This is a little trail guide map to the posterior lower extremity and how to palpate things quickly. Looking here, the easiest landmark to find is the gastrocnemius muscle belly. If you look at the muscle belly's medial and lateral, the midpoint of the medius part of the muscle belly is where you would find a typical trigger point. So this is medial gastroc, lateral gastrocnemius, and then if you roll your thumbs down here where you fall off the muscle belly heads, you are now on the soleus, medial soleus, lateral soleus, which by the way refers pain to the SI joint. If you come above the gastroc, above the medial gastroc, after you come over the roundness of it here, you'll find a little flat spot just inferior to the knee joint line. This is the popliteus that runs laterally in a diagonal pattern. Remember, the popliteus is a dynamic lateral stabilizer at the knee. And then if you come directly across here, you will feel the fibular head. The bony part of the fibular head is important to palpate because the bicep femoris or lateral hamstring attaches from the top, and the peroneus longus attaches here from the bottom. Tibialis anterior also attaches to the front of it, and trigger points in any one of those muscles can alter the position of the fibular head and cause knee pain. And then if you go from the fibular head up, you will feel the bicep femoris tendon, which runs at a diagonal up towards the ischial tuberosity. And then coming on the medial side, directly across above the crease of the knee, about an inch and a half above the knee joint line, is the semitendinosus and the membranosus. Remember, the tendinosus is more superficial, the membranosus is deeper. The membranosus is the stabilizer of the knee, and the tendinosus is the prime mover in knee flexion. And those converge up at the ischial tuberosity in this A fashion. So if you start massaging the lateral hamstring, you will actually feel like you're more in the middle of the thigh when you're massaging lateral hamstring versus medial hamstring.